We are waiting for that family meeting coming up at 8 o'clock with the President. The NICD has just released the latest stats on new infections, and in the last 24-hour period, 8,436 new infections. It is very clear it's trending upward, and it's trending sharply upward, Shahan.
Yeah, definitely. So we have been ranging from 5,000 to 9,000, and of course yesterday was just over 5,000. Today we're seeing an increase again. And
I have to tell you, shockingly, 208 deaths in one 24-hour period. That is really awful news.
Yeah, definitely cause for concern. And that's why the President is speaking to South Africa at 8 o'clock. We will take that live. Ahead of that presidential address, let's speak to public health medicine specialist Kerrin Begg from UCT. Kerrin, thanks for your time. We appreciate it. Just reading the latest figures in the last cycle is a clear indication that South Africa needs to adjust to a stricter lockdown level. What do you reckon the President's going to say?
Yeah, it's very concerning. Our test positivity rate hasn't actually been this high for a very long time. Everything is indicating it's going up, not just cases, but also hospitalizations, oxygen use, and as you've mentioned, deaths as well. So I think that, lockdowns are, as I've said before, blunt instruments, but they do restrict movement. And COVID is spread human to human, by droplet spread, but it really is about humans congregating and humans travelling. And so lockdown measures, whilst they are blunt, at least stop movement and stop congregating. And so I suspect that the President will announce some form of restrictions, curfews, aspects around events and limiting congregations of people. Of course, we know that other measures such as alcohol and others at least alleviate some of the burden on the hospital system, on the health system in terms of admissions and cases. I think that, I'm not sure which route he'll go there now, but certainly I think that the more refined lockdown measures that he's done, where restricting alcohol sales over weekends does at least prohibit some of the binge drinking, which results in additional trauma that burdens hospitals, which are already feeling overwhelmed with cases. So I suspect curfews and limits to congregating in terms of in numbers.
So what about provincial restrictions? We saw that coming in with the second wave. Beaches were closed in certain areas, and we also saw certain provinces taking the lead in putting those restrictions in, even before the President had announced it. We know that I think it's at least two-thirds, if not more, the cases in the second wave are here in Gauteng. And much as I don't want to be restricted to one province, would it be a good idea, perhaps, to say, look, no unwarranted travel in and out of Gauteng until we are through the worst? Do you think that is something that the Command Council is considering or has been considering?
So, interestingly, we didn't have restrictions to interprovincial travel during the second wave, which was much worse than the first wave. So remember, it was about double. Interprovincial travel, particularly when we were still trying to figure out what we were dealing with in the COVID pandemic in the first wave, was when we were restricted. I think that it's a particularly challenging decision to make politically because of impact on the economy, etc. I do think that probably less than travel. So initially, remember, the travel restrictions were there to stop seeding. I think, that horse is already bolted a long time ago. We've got seeding everywhere in the country, and we are seeing some small shifts in the variants, but I think that, variants even we're not going to stop variants spreading in the country. So I think that it's unlikely that we'll have interprovincial travel restricted because COVID is present already around the country. What I think would be a good idea is to have provincial tighter restrictions in provinces that are worse affected relating to gatherings and such like. That would make sense. So to not impact on rural areas and provinces that either are sparsely populated or have relatively low incidence rates, but to rather focus on the provinces which are harshly hit. But I think that the horse is bolted in terms of preventing interprovincial spread.
Kerrin, just a question, and it's twofold. If you look at the hospital admissions, the NICD said yesterday it was 936 admissions at 153 hospital deaths. Of course, today it's over 200. How much pressure do we have on our hospitals right now, given these increased numbers? And does it warrant an even more heavy response from the president because of that compared to previous waves?
So I think that, second wave caught us unawares in terms of the rate and the pace at which the increases happened. First wave, we were just still trying to figure out how deep, how wide, and how bad it was going to be. Second wave, we kind of knew how to deal with infections and some of the treatment modalities for COVID patients, but the pace at which it happened really outstripped our resources. Third wave, I think we're a little more ready in terms of knowing what to do. But certainly the hospitals that I'm familiar with are already starting to de-escalate elective surgeries and also any non-essential services, so anything that can be deferred. Of course, anything in healthcare that you defer to later will always potentially come back in a worse situation. So if you're not seeing your diabetics for their routine appointments, then at some point, it's going to come back at you later with a worse condition. But in a crisis, that is what you have to do. So at the moment, wards are being extended and opened and converted to COVID wards. So surgical wards that would have had surgical patients for elective surgeries are now being converted back into COVID wards again. So the pressure is there, but I think that it's really more in terms of preparation and increasing as you see the cases increasing, preparing for nurses and doctors and other healthcare workers who are usually allocated to different spaces to move back into COVID spaces again. I think that obviously the advantage with having vaccinations is that at least healthcare workers are not protected from becoming infected necessarily, but they certainly are protected from severe disease. So I think the one light on the horizon is that healthcare workers at least are not having to fear for their own health as much as they had to in the first and second wave.
Speaking of vaccinations, we're probably coming in for sort of 1.8 million jabs administered. We also know that there's a shipment of 300,000 jabs directly for teachers, and we heard from Aspen Pharmacare that they are ramping up really quickly, and they should have 1 million doses of Johnson & Johnson, which of course is the single shot, hopefully ready by Monday next week. Of course, that is not going to make a significant difference with this third wave because it's crashing around us as we speak. But how concerned are you still about the vaccination rollout?
So I think that it's been incredibly encouraging that we've had up to 80,000 vaccinations done in a day. At the moment we're limited by vaccine supply rather than by capacity to deliver vaccinations. So I think that's really encouraging. I think there were a lot of naysayers indicating that we really weren't up for the delivery of such a big program. But actually, I think we're getting there. We need to get to about 300,000 a day, but in pretty much a month. Of phase 2, we already can deliver 80,000, and we could deliver more if the vaccines were available. So I think that's incredibly encouraging. I think for this wave, remember that we start to have protection within 14 days. Obviously, that's only first dose if you're getting Pfizer. But even first dose of Pfizer provides some protection. And remember, the protection that it's providing for us predominantly initially before we get population immunity is protection against severe disease. The pressure on hospitals and for admissions is those who are susceptible to very severe disease and requiring ventilation and intensive care, and those are our elderly, and so of course that's why we're prioritizing the elderly now. So the quicker we can get them vaccinated, the quicker that they are protected against severe disease within 2 weeks. And so, we just need to keep going and get as many vaccinated as possible. Healthcare workers obviously have a little bit more comfort on their side, and the sooner we can get to population immunity, the better. But certainly it's not going to we're not going to see population immunity in this third wave.
Absolutely.
But we certainly may well be able to protect the pressure on hospitals.